With the number of Americans without health insurance surpassing 47 million, free medical clinics across the country are increasingly bearing the burden of caring for the nation's uninsured. Many of these clinics, like the Muslim Community Center in Silver Spring, Maryland, are faith-based organizations that see helping the sick as part of their religious duty. Dr. Asif Kadri founded the clinic in 2003 with his wife, Safiya.
See, what made our clinic different, in addition to providing primary care, we have now, the clinic is open almost every day and providing care, and this is not what you see in other clinics.
What began as a simple project designed to help a few members of the Qadri's mosque each week has in 5 short years become a major operation, relying upon the assistance of 22 volunteer doctors and 70 clinic volunteers to help nearly 6,000 patients a year.
Well, it came from my husband's private practice. We started with one room with a mosque, and by and large, we took everything. They even had the bathrooms. We took them and made them into the examination room.
Although the clinic is affiliated with the MCC Mosque, its operations are largely separate.
They have no imposition on us. They do not interfere with us. On the other hand, they have been at every step, every point, they have been outright, and they go beyond, they call it duty and responsibility to help this clinic to provide the services.
It is that connection between their beliefs and their volunteer work that has fueled the growth of some 25 Muslim-based medical clinics around the country. Dr. Faisal Qazi, director of the Association of Muslim Health Professionals.
Charity is an essential component of faith in Islam, and one of the ways this component is formalized is in the form of zakat. Zakat is one of the pillars of faith in Islam. This is when people who have assets and have savings contribute a percentage of their income towards the need of poor, those really in need.
Although the clinic gains much of its funding from the mosque and private donors, it wouldn't exist without substantial assistance from the local Montgomery County government. For patients like county resident Latifa Kadir, the clinic is the primary source for critically needed medical care.
I was ill for a while, and a friend of mine told me about the clinic, that it was available, and so I called, and I called in late November, and I started going there in January of this year. It's made it possible for me to be mobile now, where I wasn't very mobile beforehand because the arthritis had stiffened my legs and feet.
A growing number of Muslim-free clinics across the country have been helping patients like Latifa.
Muslim-free clinics subsequently became to mature and materialize, beginning with early clinics in Los Angeles and in Houston, for example. In fact, the majority of the clinics are serving large portions of the community in general.
The clinic's willingness to serve patients of all faiths is something Imam Muhammad at the MCC Mosque fully supports.
No matter what, religion background they have, no matter what, ethnic background they come, it's open for everybody. And that's what Islam itself also stands for.
The Muslim-free clinics and the number and rise of Muslim-free clinics actually parallels other faith-based efforts, such as the Catholic and Jewish communities. I think Muslims are definitely inspired by the work of the faith-based communities have provided.
As with other religiously affiliated healthcare providers, one challenge to the success of the Muslim health centers has been handling wider controversies over the medical care available at free clinics, such as providing family planning. But Dr. Shaukat Ashai, medical director at the MCC clinic, says he has not encountered a conflict.
The only thing we do not provide here is termination of pregnancy. But if the patient requests termination of pregnancy, we'll refer them outside. It's not that we won't even talk about it, but we'll refer them outside our domain.
There were a few issues. We had mentioned abortion, for example. And the reason some of those are not at this point an issue is because, number one, it's not considered essential service at this very point. At this time, free clinics are not dealing with issues that are highly controversial in that sense. Could that be an issue in the future? It's certainly possible.
Disputes over care sometimes come out of ties to the Muslim faith. But it's the religious connection of these clinics that has inspired doctors and resonated with patients.
But I think all faiths teach you the same thing, care for your community. And especially in Islam, growing up when I was a little kid, my parents told me that you had to take care of your neighbors. And first your family, then your neighbors.
By Dr. Kadri being a faith-based individual himself, it helps with the delivery of the healing process.
Aside from providing a religious connection, the clinic also boasts an unusual variety of specialists most free clinics do not have the benefit of offering.
We have 2 gastroenterologists, 2 psychiatrists, 1 cardiologist, 1 pulmonologist, and 1 ophthalmologist.
But with its breadth of services and growing number of patients, the Muslim Community Center Clinic, along with others like it around the country, faces difficult decisions on how to handle the rapidly growing demand from a rising number of uninsured.
The challenges, resources, organizations like Association of Muslim Health Professionals that I represent are continuously evaluating and providing these clinics options and resources and access to avenues of funding in order to sustain their ongoing efforts.
The stress of finding new funding is also putting pressure on Montgomery County administration. Ruth Martin, who runs a county assistance program supporting 10 free clinics, projects nearly 100,000 people in her county of 1 million need some assistance getting health coverage.
That's an estimate before the current economic situation. We have some anecdotal information from our people working in eligibility that there are more people coming in.
It's a pressure the volunteers at MCC are feeling.
We are seriously worried about that we cannot catch up with the growth. Growth is tremendous, and a lot of people are losing jobs, and then the people who had insurance last year don't have it now, and we just don't know. We're doing meetings. We're losing sleep over it.
The number of patients we see per week, it seems that it is making an impact in the sense, where would those patients go? It is not that the patients who come here for a common cold, we hardly see those kind of things. We see real problems here.
With no easy solutions to the national healthcare debate, clinics like the one at MCC will continue to struggle with the challenge of caring for the mounting number of uninsured.